It started in the 1970s, children in Lyme, Connecticut developing what was first thought to be juvenile arthritis. Over 30 years later, what's now known as Lyme disease is on the verge of being an epidemic greater than AIDS. At least that's the claim of a new fascinating documentary called Under Our Skin.
Are you able to stand up, honey?
The new film Under Our Skin documents the debilitating effects of Lyme disease, tracing the discovery of the illness in Lyme, Connecticut in the 1970s to present day and the difficulty in diagnosing it.
You might have a few weeks of body aches, and then you might have a few weeks of headaches, and a few weeks of real profound fatigue, and a few weeks of confusion.
I had a rather classic case of neurological Lyme disease with all the usual trimmings. It took 5 doctors to figure it out.
The disease is transmitted through bites from infected deer ticks and results in symptoms ranging from fever to prolonged fatigue to paralysis.
All the articles basically state that this really isn't that big of an epidemic and that it doesn't really do that much to your body, and that it's just a very easy, quick cure. Obviously, those people haven't actually seen what it does.
But as the film also presents, there are some in medicine who question whether Lyme disease even exists at all, or whether its symptoms are simply psychosomatic, something patients featured here frequently experience.
People called me a hypochondriac.
They said I needed to see a psychiatrist.
You need to see a psychiatrist.
The Centers for Disease Control reports there were over 27,000 cases of Lyme disease in 2007, an increase of 7,500 from the year before. But despite the growth, there's still no major consensus on a treatment.
Some of the Lyme literate physicians are practicing medicine that is widely outside of the standards of medical care.
Ultimately, though, Under Our Skin is a documentary that sides with Lyme disease patients and the doctors willing to treat them. And with me now are Donna Castle, whose daughter has Lyme disease, and Dr. Todd Ellerin, Director of Infectious Diseases at South Shore Hospital. Welcome to both of you. Thank you. Doctor, let me start with you. After 30 years, how are we still at this point where there's no definitive way to really diagnose or even be certain that this is Lyme disease?
Well, I think I'd like to first of all break down Lyme disease into 2 different parts. I think one part is more controversial than the other. The first is that there are acute stages of Lyme that can be divided into 3 stages. And the first is patients who present with a single rash. That's very classic for Lyme disease. That's
the
early
bullseye
Lyme.
that most people think of.
That most people think of. And that is really readily treatable with oral antibiotics. And then there's a second stage, which patients can have multiple rashes. Typically, the bacteria has gotten into the blood and then can spread to the skin. Sometimes it can cause neurologic Lyme. And that, again, is typically readily treatable with antibiotics. Sometimes you need a longer course. And then there's a third stage of Lyme disease that some people call a later stage. And that often patients will present with an arthritis, sometimes a blown-up knee. That can be debilitating to the point where sometimes patients will limp, but even that typically will resolve with antibiotics. Now, there's a more controversial stage, which is what happens after Lyme disease. So what some people call chronic Lyme disease or a post-Lyme syndrome. That is, there are a minority of patients with Lyme disease that can have chronic symptoms, fatigue, concentration difficulties,
well, let me
aches
bring
and
Donna
pains.
in here because your daughter was diagnosed with Lyme disease. She's 29 now. She was diagnosed at 25, but not right away.
Not right away. We figure she had Lyme disease from the time she was about 11 years old, and when she was 25 years old, she was misdiagnosed with ALS by a doctor in Arizona. Luckily, we had a second opinion back here in Massachusetts with a doctor in Air Mass, and she re-diagnosed her with chronic Lyme mimicking ALS, which she saved my daughter's life.
So was she like the woman that we just saw from the film, who's so close to paralysis, hunched over, walking slowly, constant pain?
Not quite that severe. She had constant pain. She had difficulty walking upstairs. She had curling of the hands and difficulty with muscle wasting, cognitive problems, pain, joint pain, that finally went into no pain at all.
And what treatment did she have?
When she was 25 years old, the doctor started her on a 30-day Rocephin treatment, which is usually the standard protocol for neurological Lyme disease. She had that IV eye treatment for 30 days and had remarkable progress. After that time, because of the guidelines through the Center of Disease Control and IDSA guidelines, Lyme disease is usually not treated for more than 30 days.
Well, let me bring you back, because you were just talking, I assume that's the point at which we start to get into the controversy that you were just alluding to. What is a controversy with later stage Lyme disease?
So the question is whether later stage Lyme disease should be treated with antibiotics or not. And that's where there are various physicians that are healthcare providers that are diametrically opposed. There's one group that feels that while these patients do have real symptoms that are concerning, but that antibiotics don't work, or the risks of antibiotics outweigh the benefits. Whereas another group, which sometimes is referred to as Lyme literate specialists or Lymologists, where they feel that the benefits of prolonged antibiotics outweigh the risks of the antibiotics. So that's where we stand, and it's unresolved. There have been some studies that have presented that looked at treating patients with chronic symptoms with prolonged antibiotics, and the result of that, at least one study, showed that there was no benefit in the aggregate.
And that's where the Infectious Disease Society of America comes down, and that's where health insurance comes down as well. So do you treat people beyond that initial stage?
Well, I generally do not recommend that patients with chronic Lyme disease be treated with prolonged antibiotics. And the analogy I give is like you have a house that has a bad storm over it, like a hurricane. And then you're treating, and the house is the person, and the hurricane is the Lyme disease. You treat with antibiotics, that causes the hurricane to go away. Now the sun is shining over the house, but the house has damage. There's shutter damage, the foundation is sturdy, but there is damage. If you treat with more antibiotics, the sun is shining there. It's not necessarily going to repair the house. That's sort of the basic analogy that I try to explain to my patients. They have real symptoms, and sometimes these patients do feel better while they're on antibiotics, but in my experience, that's not long lasting. And we're concerned about the complications with resistance, and then sometimes, rarely you can have serious side effects.
Donna, how do you feel about that? Because I know you're working on legislation right now, and there are a couple bills on Beacon Hill. Right. There's also federal legislation right now regarding all of this. Right. Would you like to, how do you feel about what the doctor just said? Do you feel that there should be more treatment?
Yes, I do. I have been become an advocate for over the past 4 years with the devastating diagnosis I got from my daughter, and saw what long-term antibiotic treatment did for her. When the doctors, the Lyme literate physicians, do put them on antibiotics, there's also supplements, probiotics and stuff that they're to take as well to protect their stomachs. But in the long run, the antibiotic therapy that my daughter has had for 2 years now, she hasn't had any complications on it. And in fact, she's off antibiotics now for the first time in 2 years. And how the chronic Lyme disease doctors like to judge whether they're in remission or not is when they go 3 or 4 months without any recurring symptoms, which it's been 1 month, and so far so good. She's looking pretty good.
So I would imagine all of this could be circumvented if so many people were diagnosed early on. But it seems, at least the film posits, that a lot of doctors aren't even familiar with the symptoms, so they're not able to diagnose early on. You have cases like Donna's daughter who are misdiagnosed by several doctors before finally finding one who can correctly diagnose. How do you assess the medical field in terms of Lyme disease right now?
Well, I mean, as you saw, the Lyme disease is on the increase, and we're certainly in one of the hotbeds in Massachusetts, and I think that we have to try to know the earliest signs and symptoms. And I think the rash, while unfortunately not everyone gets the rash, but approximately 3/4 to 80% of patients will present at some time with at least a rash, and to know that if you have an expanding circular red rash in the summertime and you're in a Lyme endemic area, that we want to have a low threshold for treating patients empirically, especially because it's at that time when the Lyme antibody test is less sensitive. At the later stages, the Lyme antibody tests are quite good.
All right, well, thank you both for coming in. The film it can be seen at the MFA in North Falmouth and Newburyport. And thank you for shedding your light.
And still in Boston.
In Boston at the MFA.
Yeah, excellent film.